University of Pennsylvania. So what is cognitive behavioral therapy? We have a little video for you.
Hey, my name is Woody. Today, we're going to talk about cognitive behavioral therapy. It's sort of a mouthful to say, so it's usually just abbreviated to CBT. If we break it down, the name cognitive behavioral therapy gives us a pretty good idea of what it's about. CBT is a type of psychotherapy that deals with our thoughts, that's the cognitive part of the name, and our behaviors, which is of course the behavioral part of the name. CBT has been thoroughly researched and found to be an effective treatment for all sorts of disorders. Some of these are depression, anxiety, trauma, phobias, addictions, eating disorders, and I can keep going on and on, but you get the point. In some cases, the treatment can be effective in as few as 8 sessions, and the effects are long-lasting. Alright, let's talk about the theory that's underpinning all of this. CBT is based on the idea that our thoughts affect our feelings and our behaviors. Something happens to us, we use thought to interpret the event, which, by the way, can happen so fast that we don't always notice it's happening, and then finally, we react to our thoughts with the emotions and behaviors. Here's a quick example. You call your friend and they don't answer. Now, 2 different people could have 2 different thoughts about the same situation. Person A might think, my friend must be busy, while person B could think, my friend doesn't like me. Person A is going to feel fine and will probably just send a text or something. Person B is going to feel sad and they might dwell on what they could have done to upset their friend. This is called an irrational belief. The irrational belief happened when person B thought that their friend didn't like them without actually having evidence of that. All they know is that their friend didn't answer the phone, and they added more to it in their thoughts. During CBT, a therapist will try to help their client identify their own irrational beliefs. This can be more challenging than it sounds. Remember what I said earlier, these thoughts can happen so quickly that we don't even notice them. When this happens, they're called automatic thoughts, because they happen automatically outside of our awareness. Next, the therapist will help the client to challenge their irrational beliefs. This doesn't mean trying to make all their thoughts be positive and happy. It means making them less negative and a bit less irrational. Usually when a client is able to do this, they start to feel a bit better. CBT therapists also try to help by directly addressing behaviors. Someone who's anxious or depressed usually has some behaviors that are actually contributing to their problems. For example, someone with social anxiety might avoid going out with friends, which will, in the long run, lead to them having fewer friends. Things like this can often lead to thoughts such as, I don't have any friends, it must be because I'm so awkward, which will then, in turn, worsen their social anxiety because of their fear that they're awkward. A therapist will help by trying to change these behaviors that contribute to the negative thoughts and feelings. One final big question. Why do some people have these irrational and negative thoughts while others don't? Why did person A think that their friend was busy while person B thought that their friend must be upset? One explanation is that everyone has different core beliefs. These are the beliefs that we hold at the core of who we are that shape how we see the world. Imagine our beliefs as a lens. Everyone has a slightly different shape. Person A's lens says, people are kind and I am a good person. Person B's says, I am unlovable and I am worthless. When person A and B go out into the world, they experience everything through the lens of their core beliefs. Oftentimes, these beliefs can be negative and self-defeating. CBT can be used to get at these core beliefs and change the ones that aren't beneficial. In summary, CBT is a type of psychotherapy that addresses how a person thinks and what they do in an attempt to change how they feel and how they function in their life. CBT has been found to be very effective in the treatment for all sorts of disorders. Thanks for watching. I hope you're leaving with a better understanding of cognitive behavioral therapy. If you like this video, visit our channel and subscribe to see more videos like it. Our website, therapistaid.com, also has all sorts of tools like
Okay, so that was a pretty good video that gives you a nice overview of what CBT actually is. So what is it? You know, it's a short-term therapy. Like in the video, it says it can be done in as little as 8 sessions, and then after that, it can have long-term effects. It is used to identify how thoughts affect emotions and our actions. We also start tying this into our consequences to make our clients think a little bit more long-term, where, you know, like he said in there with the friend, you know, one person is going to think the friend is busy while the other one thinks that, you know, they don't like them. So trying to get the clients to see how that all connects together. One of the main goals is to reveal and change false beliefs that the client may have about a situation. So how do you use CBT? You can use it in a variety of sessions. You know, you can do individuals or group sessions. There's also skills that are available. You know, some skills are there to teach you how to handle social situations, handle your emotions, communicate better, or actually how to get involved with people and find support and celebrate good things that are going on in your life. A lot of clinicians start doing some role plays to slow down their thinking and when they would encounter some unwanted event, whether it be involving substance use or just, you know, any other unwanted event, you know, whether it be miscommunication or when they get angry and then they start fighting, they can do role plays about that. And then there's also worksheets. There are definitely a variety of worksheets that can look at different stages of your life. You know, are you looking at your thoughts? Are we looking at our emotions, or everything all together and see how it affects us? So benefits of CBT, like I said, it can be used in a variety of settings. Some of those could be jail, prison, treatment centers, a counselor's office, or even a school. Instead of focusing on what's happening in a person's life that got them to where they are, we look at what is the here and now. We look at what is their current problems that they are facing, and we start getting them to look at how can they improve their life. And overall, this can help a client become more of an individual, because they have to look at what their own problems are, and then also empower them, because with the skills that they will learn, they will actually be able to apply all of this to their life and hopefully live a better life where they are a better communicator and they're not forceful but assertive. You know, they're able to talk to people. CBT helps clients focus on facts instead of the irrational thoughts. Some of the diagnosis that can be treated by CBT, like it had said in the video, was substance dependency, anxiety, depression, eating disorders, post-traumatic stress disorder, or any other traumas, and there's even more than that. So there are some negatives of CBT. You know, one thing about CBT is it's not meant to process through emotions or events that happen in somebody's life. So when recommending a client for treatment, you have to kind of compare, what do they need? Is it more the cognitive part that they really need to focus on, or do they actually need to process through something that happened in their life? So that's a big part of when you're recommending somebody for treatment. The other thing is CBT cannot be used on someone who is cognitively impaired, because unfortunately they won't understand the cognitive restructuring that you're trying to get them to realize. So how do I use CBT? Personally, I use it in CBISA, which is Cognitive Behavioral Interventions for Substance Abuse. And I found this little picture up here that, you know, says the motivational engagement, cognitive behavioral social learning, emotion regulation, social skills, problem solving, and relapse prevention. We poured elements of effective intervention into curriculum. And I just kind of found that interesting because it is a nice summary of what CIBISA truly is. So with CIBISA, there are 6 modules, 39 sessions. There are a few pre-treatment sessions that an agency can choose to do. Currently, our agency does not at City County Alcohol and Drug Programs. As they work through treatment, they're introduced to a variety of different worksheets. And here are just a few of them, where we have the decisional balance worksheet, the replacement thinking, risky emotions, body language, and physical sensations, and the behavior chain. Okay, so the first one I have up here is the decisional balance worksheet. This one can come off a little bit confusing because it's one of the first skills and worksheets that the clients are introduced to when they start treatment. So the decisional balance worksheet is used to help you decide if a change is worth it. You identify goal at the top, and then the first box, you identify what are the benefits of staying the same. So let's say we have a goal of, should I stop smoking? Smoking cigarettes, that is. The benefits of staying the same, of continuing to smoke, would be that you get that instant relief, you have your nicotine fix, you get to socialize with other smokers, anything like that. Then you move to the next box, which is the top right box, which is the cost of staying the same. And in that box, you would ask yourself, what are the negatives of continuing to smoke? And for a lot of people, there's the risk of cancers, whether lung, throat, whichever it is. The cost would also be, the cost of money. How much money do you spend in a week or a month on cigarettes? And then, it's just one of those things where you try and think of what other negatives might there be of continuing to smoke. Then we move to the bottom left corner, which is the cost or difficulty of change. So basically, what are the negatives of stop smoking? It would be that you don't get to socialize anymore with your smoking friends. You have, so you're not socializing, you don't have that nicotine fix, and you just have a change in your life, and you might gain weight since it's very common. One of the benefits of change is that next box to the bottom right, where the benefits of change could be, you live a healthier lifestyle, you're saving money, you don't smell like smoke, anything like that. The clients use this in the beginning of treatment, and they are asked to, look back on it every once in a while and see if it can be used in a current issue. Then we have creating replacement thoughts. This is taught to the clients in Module 2, normally in their Session 7 of CIBISA, where you think of a risky situation, such as, a client, maybe someone in their family dies, because that's very risky for many people. You then have them fill out the left side, which is, what are your risky thoughts about losing a loved one? And, some of that would be, why did this happen to me? Why did they leave me? Anything like that. Then after they fill out the left side, then you start working on the replacement thoughts. And the key thing that we're working on in this area is that the clients think of replacement thoughts that are stronger than their risky thoughts. So replacement thoughts for this could be, well, they're in a better place. They wouldn't want me to drink, anything like that. After the client has all 10 boxes filled out, 5 on both sides, there's another exercise that you can do with this. You can have 2 clients stand together, and one client will read the other client's risky thoughts, and then you will have the client who filled the sheet out say their replacement thought. So again, it would be, I should have a drink to honor my friend. Then the replacement side would say, they wouldn't want me to give up my sobriety. When you do this, you see how confident a client may or may not be with their replacement thoughts. And again, the biggest part about this is making sure their replacement thoughts are stronger than their risky thoughts. And again, that will come out very clearly when they do this little back and forth of, risky thought, replacement thought. And then you also get to ask them, which side do you think is more convincing and do you think you'll actually listen to? Then in Module 3, one of the first lessons that they are taught is about emotions. One of the biggest things is we don't like to label any emotion as bad. It's just about learning to manage emotions. So there's a worksheet in the book where they identify a risky emotion, physical sensations, and body language, all associated with their risky emotion. So you may be asking, what is a risky emotion? When a client comes to us, we have them start thinking about, what kind of emotions do you normally have when you get in trouble? Is it that you're sad? Or is it that you're really angry? Or are you celebrating something and you're so excited that you just let go of the common sense that you've had before? So I have an example up here of, you have your anger as your emotion. Well, then we want to know what physical sensations come with feeling angry. So physical sensations are what you feel on the inside of your body. Where in your body do you feel that emotion? Physical sensations can't be seen by anyone else. So some of the things that I wrote up here are, your heart is racing, you're feeling hot, your fingers are tingling, you're seeing red or tunnel vision, where then your body language is, what can I see this person doing? So body language would be something else that somebody could tell you that you're doing, or how we tell somebody's mad. So, pacing, fist clenched, face is red, sweating, or cussing. Any of those things. So again, it's what you can see or you can hear. And then we also had sadness up here, where your physical sensations or your first warning signs of what emotion you're feeling would be feeling down, you feel a pit in your stomach, you feel like crying, you feel empty, or you feel heavy, like there's a weight on you. The body language associated with that could be crying, slouched shoulders, quiet, bloodshot eyes, or maybe you're isolated, like you're not coming out of your bedroom after some incident. This is really good because then we use this as we progress through treatment. They will then learn skills on how to manage the different emotions of, there's all the self-control strategies of paced breathing, pleasant imagery, taking a break, distraction, great techniques on how to manage these emotions. So behavior chain. This is what the start of a behavior chain looks like. Clients in CBISA definitely get used to behavior chains. I would say on average, the clients do pretty close to 30 at least, and that's a 30 front and back, so 60 pages total throughout the CBISA program, as it's a huge chunk of their success plan that they present at the end. So when you first start a behavior chain, you're going to do the risky side. And when you do a risky side, your action is always going to lead to substance use or breaking the law. So our example up here that we're going to do is that a friend offers me drugs. So when you give this form to a client, you ask them, what kind of risky thoughts might you have that could lead you to using substances or breaking the law? Some of the thoughts could be, I could get away with it, I miss hanging out with this friend, we used to have fun, I bet it would feel great, it would just be this one time. Once they figure out what their thoughts could be, you then ask, what would your feelings or emotions be? This is going to vary between client to client, but on average, something along these lines where they're mischievous, they're anxious or nervous. Then again, our actions, use drugs with my friends. And then the final box is to ask, what kind of consequences are you going to have from your actions box? So first you have your positive consequences. Got high, got to hang out with friends, I had fun. The negatives could be lost sobriety, PO is not happy, jail time, fines, probation violation. Then they would normally flip the page and do a replacement side. The thing with behavior chains, you're going to do a risky and replacement side for each behavior chain. So your situation is still going to be the same. Friend offers me drugs. Then again you ask, what kind of replacement thoughts could you say to yourself to stay out of trouble and stay sober? So I shouldn't do this, I'm on probation. If I end up in jail, I could lose my job. If he was my real friend, he wouldn't put me in this position. I need to take care of my kids. With those thoughts, you're going to have different emotions compared to what we did the first time. You know, you might be feeling mad because your friend put you in this situation, nervous because he is still offering me drugs, but still proud because you're going to say no. So this example, our person goes home to kids and takes them out for ice cream. So again, we ask positives, spent time with kids, no jail time, PO is happy, got ice cream, still have my job, and I'm still sober. The negatives, didn't hang with friend and didn't get high. So with this again, we have clients do this with so many different situations as it allows them to see where their risky situations are, and they also get to see how one situation could affect them in many different ways depending on how they react. Throughout the treatment, depending on what agency you go to, this treatment will last a different amount of time. At City County, our phase 1 of CIVISA, which is the first 6 modules, lasts about 4 months. Then for aftercare, that's about another 2 months. I've seen some other agencies where it's about 8 months to 10 months long before they're done with CIVISA altogether. And so they do behavior change throughout the first 4 modules, primarily in modules 3 and 4. And then module 6 is where they bring everything together. That's where their success plan is. And the first part is looking at their life history of what did bring them to where they are. Were their parents substance abusing? Were they law breaking? Did they get divorced? Were they bullied as a kid or in abusive relationships? Then you look at the lifestyle factors, which lifestyle are things that we choose to put ourselves into. Like I could choose to work at a hotel. That may not be risky by itself, but there are some situations that come up. So after you identify life history and lifestyle factors, a client works on identifying 15 high-risk situations that come from their lifestyle factors. So again, if I work at a hotel, that may not be risky, but finding drugs in the hotel rooms I'm cleaning is. Or another coworker comes to work high, that is another risky situation. Then for all 15 high-risk situations they come up with, they will complete a risky and replacement behavior chain to determine what can they do differently or how can they handle those situations. They then work on identifying what skills over the last 4 months can they use for those situations. Is it dealing with peer pressure? Is it finding support? What skills? They also look at what worksheets could they use in these situations, a behavior chain, the decisional balance worksheet, anything like that. The end part of the success plan is to identify ways that they can change or have changed, and also finding support. Then the very last part is how are you going to apply everything you learned in CIVISA to your current life and when you leave class. It's hard when you go from being in group 3 times a week to 1 to none. So finding ways to get all of that knowledge out to your current life that you're going back to is a huge part. So I have found, you know, CBT, I didn't think that would be my thing in college when I was doing my undergrad. But as I've progressed through my master's and in my current job, you know, I use Sabisa on a daily. And